Welcome to a presentation of Hive80, the #1 online community for health, wellness, and medicine. Hi everybody, this is Amy at Hive80, and today we're here to talk about how the coronavirus pandemic has translated into the discussion of vaping and vape prevention. Over the past couple of months of incessant research, we've been informed that the implications and severity of COVID-19 increased dramatically when met with pre-existing health conditions. So I'm here with Carly, former Juul user, who also has asthma. Welcome, Carly.
Thanks, I'm glad to be here.
All right. So what have you learned about the coronavirus, coupling it with asthma and vaping?
So a lot of people, when they first think about the coronavirus, their thoughts immediately go to people with asthma, diabetes, autoimmune deficiencies, but it's important not to forget that you don't need a medical diagnosis to put you at a high risk for having severe symptoms of the coronavirus. For example, active Juul users and vapers have a predisposition to be heavily affected in their respiratory system because their lungs have a weakened immune system.
Has your healthcare provider told you about how COVID-19 can affect you in your particular situation?
I have learned that the weakened immune function in the lungs, coupled with the inflammation, can make the symptoms for coronavirus even worse for people with asthma, people who have history of vaping. It also makes them more susceptible to contracting the virus as a whole.
So what are your thoughts on how millennials are handling the situation?
I think now that it's getting more serious, they're taking it a little bit more seriously, but we did suffer a lack of urgency there at the beginning. And I kind of compare it to the lack of urgency that kids have when it comes to vaping. They really don't understand the severity of the situation until it happens to someone they know or someone they love. And then by the time they're taking it seriously, it might be too late.
Tell me about your health and your history with the Juul.
So I was an active Juul user probably about 9 months ago. I have not been using it since, but when I was using it, I was using it a lot. I definitely feel the repercussions of it to this day. I'm glad I quit when I did, however. I've kind of been watching this whole coronavirus unfold through the lens of preparation. For example, I work in the service industry, and when the whole state of Colorado shut down those industries overnight, I was left without a job, and I was not prepared for it financially. I live comfortably, but I haven't been necessarily building a savings to prepare for something like this. And I kind of think the same goes for health, especially amongst young Americans. People are reluctant to stop quitting the Juul, quitting the vape, until something like this happens, and then it might be too late. So it's always important to keep those things in mind and have a safety net, whether it comes to finances or your health or whatever it may be when a pandemic like this unfolds.
Great words of advice that we're sharing with your peers. Education and peer-to-peer conversations. I mean, that's what we do here at Hive80. We can get through this crisis together, but we need to keep sharing information and resources to encourage each other not to panic, but to be careful and cautious and to keep doing the next right thing. Thanks, Carly, for being here.
Thanks for having me. I love contributing to your guys' mission of health.
For more information like this and free exclusive videos, podcasts, and downloads, please join us at hive80.com, the #1 online community for health, wellness, and medicine.